Solaris, and I'm the Executive Director of Project Access Now. And Project Access Now has been around for a little more than 7 years. For the last 6 years, we have been connecting low-income uninsured people to donated health care. We work really closely with safety net clinics in the metro area. We work very closely with hospitals. And we have just shy of about 3,000 healthcare providers that are donating their time. That what we're really about is improving the health of the community to make sure that there's access to care and services for the most in need in our community. And so we're always looking at who's the most in need, who's still falling through the cracks. And that's really our core mission, is for that population. So again, we figured, and we believe will be true, that the immigrant population is going to be a big portion of that. The way their community benefit programs were set up previously, the only way you're going to get a discount is if you don't have access to another health insurance. And previously, a lot of people didn't. Nobody could afford an individual plan. And so if you weren't employed or had some access to health care, then you were uninsured and there was nobody else to pay for you. Well, in January that changed, thanks to Cover Oregon, which is great. The problem is, though, that the people that we were serving, which were people at 200% of federal poverty level or less, so if you're at 138% of poverty level or less, you can get on the Oregon Health Plan, and that's great. We've had a large percentage of folks that we serve qualify for the Oregon Health Plan. Then there's another group of folks that aren't going to qualify for anything because of their immigration status. And then there's this other group of people that were 139% to 200%. Which back in December, as a community, we said to those people, you shouldn't have to share in the cost of your health care, your needed health care. But then when the Affordable Care Act came into place, all of a sudden now it's like, oh, well, actually, you do have to share in the cost. So these are people, again, sometimes it's a family that they may make $10 a month too much to qualify for Oregon Health Plan. So they're in a position where theoretically they have access to health insurance, but they really can't afford it. And again, 3 months ago, we agreed with them. They couldn't afford it. And now we're basically in a position where we're saying you have to pay, and it may not seem like a lot, $50 a month, but then you've got co-pays and you've got co-insurance, and going from not having to pay anything or not having the expectation that you pay anything to having that amount is pretty significant. And essentially what it was going to end up meaning is that people weren't going to get health insurance. They would choose, I think they use the term ignoring the mandate, which we think is an improper term. It's not really that people are ignoring. They really can't afford the Affordable Care Act. But we've also had the opportunity to get some funding initially from hospitals and hopefully eventually from other funders as well to actually be able to pay for some of those premiums for the people in that income range of 139 to 200%. So we started to do that about 3 weeks ago, maybe. It hasn't been very long. One thing is, I think we have to really acknowledge that there's no such thing as a perfect system. And what we really, the best we can do is get the best system for as many people as possible, and then have the appropriate safety net underneath that. And I think that, we all agree that the previous system was really not good for very many people at all. And the new system isn't perfect, but it's much, much better. And there are a lot of people that are getting access to care and that would not have otherwise. And it goes along with not just, let's make sure people get coverage, because coverage is not necessarily access, and access to care doesn't necessarily translate into better health. And what we really want, of course, is a healthier community. I think that as you'll talk to other people who've spent more time directly working with our clients, the satisfaction is that despite all of the challenge, despite the chaos, that when you're able to really help someone, when you're able to help connect someone to care, we've got stories of people who are in the middle of cancer treatment, and it's a disruption for them to have their coverage change in the middle of that. But to be able to support those people through the process, to be able to say to them, you know what, let us worry about that. You worry about your treatment. You worry about getting better. And we've had that opportunity.